autoregulation of glomerular filtration rate and renal blood flow. Now, what is autoregulation of GFR and renal blood flow, and what is the importance of this concept? So, autoregulation of GFR simply means that the amount of GFR and the amount of blood flowing to the kidney remains nearly constant. It remains nearly constant despite of huge changes in the arterial pressure. Now, to understand this concept, with the help of this graph, we will briefly talk about the renal blood flow and the different factors which will increase or decrease the renal blood flow or arterial pressure. Now, in our last few lectures, we have discussed in great detail that the kidney receives its blood supply through the renal artery, and this renal artery once enter into the kidney. This is the kidney, for example, and this diagram is showing the vasculature. The kidney receives the blood through the renal artery, and it divides into lobar artery, arcuate artery, lobular artery, afferent arteriole, the glomerular capillaries, the efferent arteriole, then the lobular vein, arcuate vein, and lobar vein, and finally the renal vein. And we also discussed in great detail that pressure, the arterial pressure in the kidney at the start of renal artery is 100 millimeter of mercury, and at the end of renal vein is around 4 millimeter of mercury. The arterial pressure basically keep on decreasing along the vasculature of the kidney, and a great decrease in arterial pressure occurs at around afferent arteriole and efferent arteriole. And we also discussed different factors which were basically the determinants of renal blood flow, and those factors like sympathetic nervous system activation, the release of norepinephrine, epinephrine, endothelin, angiotensin 2, and nitric oxide. Those factors which were the determinants of the renal blood flow, they could increase or decrease the renal blood flow, and the amount of renal blood flow can also be influenced due to the increase or decrease in the arterial pressure. Now, these factors basically they increase or decrease the resistance, which ultimately increase or decrease the arterial pressure along the renal vasculature. Now, changes may occur in the arterial pressure. Different factors, different determinants may bring changes in the renal blood flow. But how the kidney is regulating these changes, and how is the kidney trying to maintain the filtration rate, the glomerular filtration rate, which is occurring at the glomerular capillaries, which we discussed previously in detail. Like this is the glomerular capillary, and filtration is occurring here. Blood is coming through afferent arteriole and leaving it to the efferent arteriole. Now, the arterial pressure in these vasculatures may increase or decrease, but the filtration process in the blood, the renal blood flow, it is maintained within narrow limits, and that is basically the autoregulation. And how is it done? Then we will explain each and everything in the coming lectures. Now, let's focus on this diagram. These two graphs basically shows that here we have the renal blood flow, and the renal blood flow is basically shown with the help of this blue color. Now, this is the renal blood flow, and here with the red color we have shown the GFR. Now, the second graph shows the urine output, and on the x-axis we have the arterial pressure. We just will look at how changes in the renal blood flow, GFR, and urine output occurs when there are some changes in the arterial pressure, and then we will look at how it has been auto-regulated or maintained at nearly normal level. So let's start here. The arterial pressure normally is around 100 millimeter of mercury. Arterial pressure normally in the body is around 100 millimeter of mercury. The GFR normally is around 120 ml per minute. So the glomerular filtration rate, the GFR, is normally around 120 or 25 ml per minute. The blood flow, the renal blood flow, is around 1100 ml per minute. And this is basically showing the urine output ml per minute. This is the normal urine output. So this graph will show that the blood flow and the GFR will be auto-regulated, but the urine output, that is ml per minute, will not be auto-regulated. Now, at normal arterial pressure, this is at this level, we have the normal GFR and normal blood flow and normal urine output. At normal arterial pressure of 100 mm of mercury, we have normal GFR of around 120 ml per minute, we have normal blood flow of around 1100 ml per minute, and normal urine output. But as the arterial pressure starts increasing, the urine output starts increasing. As the arterial pressure starts decreasing, the urine output starts decreasing. So we have drawn these two lines to show that here the arterial pressure has dropped to around 75 mm of mercury, and here the arterial pressure has increased to around 160 mm of mercury. So between these two lines, now if we see between these two lines, there is very slight change in the GFR. There is very slight change in the GFR, and there is very slight change in the blood flow. So it simply means that there is auto-regulation of the GFR and renal blood flow. There is a big change in the arterial pressure from this point to this point, from 75 mm of mercury to 160 mm of mercury, and there is a big change in the urine output. The urine output is increasing and decreasing along with the increase and decrease in arterial pressure. It is not auto-regulated, but the GFR and the renal blood flow, it is auto-regulated. The GFR is auto-regulated and the renal blood flow is auto-regulated, and the levels are kept nearly constant with minimal changes. So there are some changes between these limits, but the changes are very minimal. Only when the arterial pressure has dropped very much, only then the renal blood flow decreases and the GFR falls. But with big changes between the 75 and 160, the GFR and the blood flow are maintained, and that's the auto-regulation. And with this graph, we only wanted to explain this thing, that even with big change in the arterial blood pressure, the level of the GFR and the level of the renal blood flow will stay nearly normal, not exactly, not 100% normal, but nearly normal. And this is how we have proved it here with the help of this graph. On the other hand, the urine output is not auto-regulated. Its level keep on increasing and decreasing along with increase and decrease in the arterial pressure. Now, how the GFR is auto-regulated, what are the factors which helps in auto-regulation of GFR, what are the factors which helps in the auto-regulation of renal blood flow, and why is it important? Now that's something which we will discuss in the coming lectures. Thanks a lot for watching the video.